cases. Now we're up to 1,374. We're including now presumptive cases, and remember, presumptive cases means that's a person who has been in close contact with somebody that's a lab-confirmed case, and they have symptoms. So they may be awaiting test results, but even if their test results are negative, if they're symptomatic and they've had close contact, we treat them as if they are a case. So we've had 163 total hospitalizations, 20 deaths. And then at the bottom of this chart, I've included the outbreaks that we're working on. So we have 5 open long-term care facility outbreaks, 5 non-long-term care congregate setting outbreaks. We also have 9 additional workplace settings that have outbreaks. And then 2 school, really they're camp settings that are also outbreaks. One thing that I wanted to give you a heads up about is that these numbers may start to go up because the state updated their investigative guidelines, and there are fewer number of confirmed cases that are necessary to declare a facility. So for example, in the long-term care facilities, only 1 case will be required to define it as an outbreak. So I just wanted to give you a heads up that you may see these numbers go up. Part of it's because there's outbreaks, and part of it is because we've changed how we're defining outbreaks based on state guidance. Okay, the next one. So I wanted to give you an idea of just the monster that we're starting to see develop. So isolation and quarantine, we have 330 households in isolation. So that means isolation, remember, is when you are either COVID positive or you're symptomatic. So those are the people that are in isolation. We have an additional 444 individuals in quarantine. In quarantine are those people that have been exposed. And of those roughly 700 people, 107 households are receiving basic needs support. So that's the additional support of food, rental support, utilities, anything else that they need to really make sure that their basic needs are met. And about 70% of the households are Latinx. So we continue to see the disproportionate impact. So the staffing that is really supporting this is we have contracts with 13 community-based organizations to support, especially the basic needs support for isolation and quarantine, because it's really about grocery shopping, delivering groceries, checking in with people every day to see what they need. And then our surge capacity staff that's really doing the case investigation, contact tracing, checking in and monitoring everybody that's in quarantine. So those 444 individuals get a phone call at least once a day, evaluating or have they developed symptoms, and helping them access any services that they may need to access. So
I have a quick question, Marnie. When you say 70% of these households are Latinx, 70% of what number of the people in quarantine households
of the
that
house
are getting basic need support?
Yes.
70% Latinx. Okay.
Yes.
Thank you.
Yes.
Marty, you have a question from Commissioner Treese.
Okay.
Thank you, Mr. Moss. Marnie, how are households that receive basic need support identified?
So
please go ahead.
Sure. So as part of the case investigation and during the follow-up interviews during contact tracing, we are asking people, if we're asking them to isolate or quarantine, then we are also asking what support do they require in order to comply with that order. And we're doing frequent check-ins because that can change over time. So for example, if you have a family where one person is still able to, well, that doesn't really apply anymore because we're isolating and quarantining the entire household, so never mind.
I get it.
But
Thank you very much.
But we are checking in frequently because things can change over time. So, and then we also have the additional 107 surge capacity staff. And so what that breaks down to is 14 nurses that are doing case investigation. We have 29 members of strike teams, which includes nurses, community health workers, environmental health staff. And those strike teams are really what we deploy when there's a workplace outbreak. And then we have 23 case contact tracers that are county staff, an additional 26 that are Public Health Institute staff. We have our 5 epidemiologists, and we're desperately trying to find more epidemiologists, but so is every other local health department and state health department in the nation. And there are very few of them that graduate each year, so we're all nationally struggling to find epidemiologists. We think that we might have found 2 more, so we're hopeful there. And then 10 support staff. That is the staffing that makes up this 107 surge capacity, just to give you an idea.
Commissioner Rogers has a question.
Yep, before you go on, 2 questions. I didn't know whether we were asking at the end. One has to do with a slide back where you were saying that, you used the word open. For those businesses who are not open, manufacturing plants that are not open, does that mean there's no reported cases?
Sorry, open, maybe I should drop that word for this presentation. Open refers to their open outbreak investigations. So it's not that
open.
right, not necessarily that the business is open, but that they're open investigations. So, yeah,
okay.
sorry, I can see where that would be. That's some of our public health slang, I guess.
Okay.
And
then
then I have,
Oh.
go ahead, Commissioner.
Then the second one is on the next page that you just went beyond. Had to do with that 70% number.
Sorry,
Marnie,
say that again?
the next, right there, the 70% of these households,
Yes.
is that migrants or non-migrant?
It is, they self-identify as Latinx, so oftentimes they're long-term residents, but they could be seasonal or migrant workers. But a lot of the Latinx community that is impacted are long-time residents of Washington County.
Yeah, I'm not concerned about that. I was just trying to figure out if some of these outbreaks were in our migrant camps. I know that Commissioner Scouten has said a few times, what resources are we putting in there? And
Right.
so this is a blend. We don't know.
Yes, the 70% it represents a blend of all Latinx that are impacted. And remember, over 50% of our cases are Latinx. But we do continue to provide a lot of support to the migrant and seasonal farm workers and their employers. Virginia Garcia continues to go to the large camps weekly. We just increased our contract with Virginia Garcia so that they can provide more support, more health support to more camps and continue that support. Also providing PPE, providing food assistance, technical assistance. So we do continue to have a very robust support system for migrant and seasonal workers.
Then I have a question, Marnie. On your point with the epidemiologists, is whether it's through whatever facilities they go through training, universities, medical schools, I don't know.
Yes.
And also through the state with regard to whatever certification, is our current public health response system set up so that students that are going through the program might have internships to help do this work versus someone who's already completed the program? I want to make sure that if we need to be using our political capital to be asking for additional help, that you know to do that with us.
Yes, thank you. Epidemiologists typically go through a school of public health, their master's level educational status, and there is no state certification that's required. And we do use students that are towards the end, but typically we use them more as data analysts, so not quite the level of epidemiology, but it's really helpful, and we have several data analysts that are kind of, I guess it's like maybe one level below. They're still learning and still need a lot of supervision and direct support from the experienced epidemiologists.
Okay, thank you
But
very
we
much.
have,
for
we
that.
typically do take students because we have schools of public health, so we do take them. All right, so we'll go to the next slide. So we're going to go through the data on this. I'll let him pull it up. It takes just a second to get it pulled up. Sure. Yeah, I don't care too much about the order. There we go. And I actually, the sad thing is I can't see which one this is. Daily hospitalizations, okay. That's really sad. My eyes are that bad that I can't, even this screen that's in front of me, I can't quite see. But
We need to get you to the eye doctor, Marnie.
I know, I think I do. They tried to give me new contacts and apparently they're not working and then it's been shut down, so I'm stuck with this for a while. But so this is the daily hospitalizations, and I think what you'll see is that over the last week, so we were pretty steady, and I think that I mentioned this last time we talked, but these numbers are still relatively small. The two big peaks at the end are 4. I believe that number's 3 or 4. And, you know, it's been between 0 and 4. And so that's pretty volatile. But what we're not seeing is the downward trend or the steady 0 to 1 that we were seeing a couple of weeks ago before we moved into phase 1. So that's what I wanted to point out at this one. So we can go to the next one. And all of these are on our reopening page. So what this is the percent of cases that are not linked to an existing case. And as you know, this is a really important measure that helps us to understand how much of the new cases are linked to community-wide spread versus contained outbreaks and cases that are related. So this helps us to understand, you know, are we seeing more cases just because we're doing more testing or because we're doing the contact tracing, which is, all of that is true, but in addition, we are seeing this community-wide spread. This is one of the better news slides because this was as high as 50% at one point, and we're heading back down closer to the goal, which is 30%. We can go to the next one. So this is our case counts, and as you can see, we've had some of our highest case counts since the beginning of this epidemic, and we are seeing over a 20% increase in case counts, and you'll see that in the next one as well. But the goal is to see fewer than 5% difference in our case counts. And what I would say at this slide and then probably the next one is I think you all received the OHA, the latest prediction. And the prediction that OHA, you know, as normal, they gave us three possible scenarios. One was the optimistic scenario, which was really based on the increase in cases being related to our testing practices. So other words, our cases might be increasing because we're doing more testing, but there really isn't an increase in viral transmission. So that was the best case scenario, and under that scenario, they said that infections would remain relatively stable around that 180 per day. And you've seen in the last week that that is not the case, and even in their prediction, they said that this is not a very realistic scenario. So then, and we can move to the next slide, because this sort of covers both. The other one, yes. So this is the slide that's pretty alarming. So in percent increases in the last 7 days. And I believe since June 23rd, although I can't see my numbers anymore, we have had over 20% of a 20% increase in our 7-day average. So I'll point out that the moderate scenario in the OHA prediction assumed a 10% increase in transmission. And based on a 10% increase in transmission, they estimated that the number of new infections per day at the state level would be 310 higher than the optimistic and would triple over the next month, so into mid-July, reaching as high as 910 cases per day, which could result in a cumulative infection rate of 38,000. That's at a 10% increase in transmission. The pessimistic scenario is a 20% increase in transmission. And again, I'll point out, we've been over 20% for over a week now. And this was the pessimistic scenario that really understood that the increase in cases was not based just on increased testing, but also increased transmission throughout the community. This would result in in higher than 560 increase in our daily numbers. And the model projects 50,000 versus 38,000 cumulative infections, 4,850 infections per day, so versus 910, 74 new hospitalizations per day, and that would overwhelm the public health system, because if you think back to the number that are in isolation and quarantine at this point, and then triple those numbers is this moderate or pessimistic scenario. So I hate to be a Debbie Downer right before the holiday, but I think it's really important that you understand the concern, the alarms that our public health colleagues are raising. And I think that this chart really says it all. And the other chart that we've just went over really quickly was just the increase in percent of positive tests, which again is another indicator that it's not just more testing, but it's more community transmission. So we can go to the next slide. Thank you. So what are we doing to address this, and so I'm going to start with the public health strategies, which you've heard a lot about, so I'm not going to spend a lot of time on that, but we are still keeping up with case investigation, contact tracing, isolation and quarantine. I shared some of that messaging with you, or some of that workload with you. But the other thing is we really need to focus on our public messaging campaigns. And Philip is here if you have any questions about more detail, but there is a desire regionally and within Washington County that we embark on a second round of paid ads, and that we would ask Multnomah and Clackamas County to join us in those second rounds. And we really don't want to do finger pointing or shaming the public. The tone would be positive and would really focus on what are the actions that people can do to reduce harm. What are the actions that can be championed on a peer-to-peer basis? And so if you want to know more about that, Philip can fill us in a little bit about that. And then, we would also continue to support the homeless population, migrant and seasonal workers, and other high-risk populations, because as the infection rate continues to increase, we become more and more concerned about medically fragile and older populations. So I'm going to pause in case you want Philip to come up and talk any more about the public information campaign that we're.
Commissioner
Excuse-
Treese has a question, Marnie.
Sure.
Well, it's not really a question, but before Philip comes up, I just wanted to provide a perspective from a phone call I sat in yesterday for the chair with the governor. And it was, the message was very similar. There are a couple points. You received the PowerPoint deck with all the information in it. But I think what's important to say is that she had two press conferences or two phone conferences yesterday, one with the commissioners throughout the state and one with the business alliances, chambers of commerce, that group. It was around the positivity rates in relationship and how they're going up. So the percent of positives in the testing, and the primary objective was to encourage mask wearing around the state. And this is something that we're familiar with in the Tri-County area, but it was considerable concern about wearing of masks from commissioners around the state. The other push was to encourage our private sector to really step up and make sure that their employees, both in the front line and in the kitchens and in storerooms and areas like that, are wearing masks. The other piece was to work with their customer base to make sure that they had that. I don't want to use the term enforcing, but encouraging those that clientele to wear masks when they come into the store or into the restaurant or wherever it might be, and supplying masks if they did not have one. So she really pushed on the fact that the private sector needs to step up. The other piece, and this is why I wanted to get in before Philip talked, is that she did say that she really wanted to see an increase in our PSAs and the communication to the communities about mask wearing. And I wanted to suggest that perhaps we talk with Mike Murray at Hillsborough and Hops and ask him if we can get Barley to do a piece with a mask on. So with that, Philip, I'll turn it back to you.
Well, before we do that, I just want to note that my Zoom view doesn't share all 5 commissioners all at once. So I haven't been seeing Commissioner Willie. So Commissioner Willie, do you have any questions that I may not have noticed? You're unmuting or raising your hand.
No, I'm good. Thank you for asking. I'm just listening to this information and the questions. So no, it's good dialogue. Thank you.
Okay, thank you. Go ahead, Philip.
We'll go ahead to the last slide, because I think my last slide is going to be about really fit with what Philip is going to share. So.
Sure. So just briefly, as your board knows, at about a month ago, your board gave us some really good direction to use CARES funds, about $100,000, to engage in paid media purchases that would really emphasize some of the points that Marnie just talked about with a positive tone. So I call it leadership by example, and emphasizing the key protective measures that our public health experts have advised for a long time now. But certainly the face covering piece has emerged, I think, as something to really focus on. So we've just about finished round 1 of that ad purchase, just under $100,000 expended. We owe your board a write-up, a report back on how things went. And then, as Marnie mentioned, there's a regional conversation about what we might do together with round two. Just for the record, we invited the other two counties in our region to participate in round one as well. And it got some favorable reaction, but no operative steps were taken. So we are, I think, in a different place now. And I look forward to doing more work with our regional partners at the board's direction.
Okay, so I think, the previous slide was about what we as public health and government can do, including the importance of really focused messaging to our public. But I think this is also a plea to our public. And with the 4th of July weekend coming up in particular, our public health colleagues across the state are very worried. We saw bumps after Memorial Day weekend, and we're expecting to see increases in cases after the 4th of July weekend. And so we're really asking people to show their patriotism safely and to really decide and think about what you're going to do for the weekend. The longer you interact and the larger the crowds, the more risk you have of exposure. And so really thinking about how many people you're going to interact with and what are the ways that you can do that as safely as possible by maintaining that social distance. And we cannot emphasize enough the importance of wearing a face covering. So we're just making a plea to our public and anything that you all can help us to do to get that message out on your Facebook accounts, your social media, your websites, through your friends and family. You can have small gatherings. We know that people miss their friends and family, but please do it safely. And our website has a lot of tips. Even, if you're going to have a small barbecue, tips on how to do that safely. Number one, easiest thing to remember is wear your face covering. So with that, I will take any other questions, and I'm sorry to be such a downer today. I keep trying to fix the data, but it
No,
won't listen to
Marty.
me. The data won't listen.
There is no apologizing for helping ensure that we understand the situation and we know how to be partners in delivering effective messaging.
Yeah.
So I know we have at least a couple of commissioners with questions or comments. We'll start with Commissioner Willie.
Thank you, Catherine. The question I had for Philip was, where would we see this? I haven't seen any of these advertisements, so I don't know if they're just on social media or if they're actually on TV, or what venue did we use to display that? And then the second part was, and I can't remember if Commissioner Treese pointed this out to me or not, but I've seen it on Facebook. There's really a good comparison of if you're interacting with a person who is tested positive and you don't have a mask on, what the very high percentage of that you're going to be tested positive. And then if both of you have a mask on, all the way down the scale to very low. So I was wondering if we are going to be using any of that analogy too, because to me that was very revealing and encouraging, I guess, to say, no, I absolutely need to be making sure that not only do I have my mask on, but the person I'm talking to also has a mask on. So I was just wondering that.
So as to the first question, the ad purchases were on social media, primarily Facebook, Instagram, and Twitter. And then there were broadcast purchases as well, beginning about halfway through June 15th. And there were internet banner ads also purchased. So in different places where you might surf around on the internet, you might see some of the ads pop up in those places as banner ads. And finally, there were print purchases made within the Pamplin Media Group newspapers throughout Washington County. All of that started about June 8th with the broadcast media purchases around June 15th, and now we're wrapping up here as we head into the July 4th weekend. And the,
We can address the poster together. So that poster has really been flying around, and a lot of people really like the poster, and I think it is helpful in a lot of ways. I would say that public health felt really uncomfortable with the percentages because it's not quite that simple. And so, maybe we're being a little too exact, but there is no study or anything that says that those percentages are accurate. But with that said, Philip and his team took that, and I think that they figured out a way to create a poster that's just as great, but just to take the percentages out. So
yes.
definitely, if both people are wearing their mask, it is more protective than if neither is wearing a mask, or if only one is wearing a mask. We just didn't feel comfortable with the percentages, so we couldn't just adopt it, but I don't know if you want to add anything.
No, that's exactly right.
Yeah, so hopefully you'll be seeing our own Washington County version of that, which will be even better.
Whoops. How about you, Commissioner Scouten? Do you have any questions or comments?
Yeah, thank you. I'm thinking aloud here a little bit. I'm not sure how we address this. I mean, there is a level of awkwardness about it, but there has become a partisan divide on the face covering. Can we work in some prominent Republicans who, at the national level, who now are speaking very forthrightly about the need for face coverings, such as Senate Majority Leader Mitch McConnell, and I think even Vice President Pence has spoken about the importance and the value and the usefulness of face covering, because we need to reach everybody. And while there's a certain level, I mean, it's perplexing to some degree that this is going on, and I know the rest of the world is utterly perplexed. But we have to kind of deal with that issue. I don't know how we do that at the county level. We typically think nonpartisan, and this really should be a nonpartisan issue. We want to reach everybody, and there's a core group of folks that are not persuaded yet about the value of face covering, and there's stigmas and issues related to face covering that we have to still grapple with. I'm thinking aloud here a little bit, but how do we deal with that? It's a reality out there, unfortunately.
Yes.
I
Go ahead.
I don't know that we can address it from a partisan standpoint, but I can tell you that one of the issues, and I wasn't really joking about having barley in one of our ads, because one of the things that came up yesterday in the discussion was really thinking about celebrities in relationship to promoting this, and whereas a celebrity would be across the board in terms of the resonance of the message. So they were talking about athletes, about movie, TV celebrities, those types. So perhaps Commissioner Scouten, that would get to your point, is making sure that we had a broad spectrum of approach in what we're doing.
Yes, I would just add my agreement with both commissioners, and what I understand from our board and county leadership is that we most certainly want to stay nonpartisan, non-political in all of this public health messaging. I'll just say briefly that there's a body of social science research regarding behavioral change. We are talking about a campaign that reaches beyond the simply making the public aware level. We're beyond objective of simply providing awareness. We want to influence. We want to have the campaign result in behavioral change among the public. That is a high, high bar to reach in any campaign, and some of the social science research indicates successful campaigns in this regard really speak to the points that Marnie mentioned earlier. Peer-to-peer associations. If your relative, if the friend down the street says, I'm wearing a mask when I go to the grocery store, period. I'm taking this proactive action that's in compliance with or in agreement with all the measures that are going to restrict the spread of the virus. And that's somebody that you know, it's someone in your family, it's someone that you break bread with, it's somebody that you are friends with. That's some of the most powerful ways of communicating there are, if your goal is beyond public awareness, if your goal is to actually change behavior. We've seen this with seat belts, with weight loss. There's a long list of studies that show that that's where you need to go. But it takes a lot more resources, it takes a lot more commitment, it takes a lot of consistency. And it doesn't hurt to have celebrities and the Hillsborough Hops mascot also chime in. That's just gravy.
And I think local leaders as well. So you all are our movie stars.
Yes.
I thought
Well,
I was,
colleagues,
but-
I'll be making some Facebook posts with my patriotic masks this weekend, and feel free to share yours as well. So that we're doing what we can to encourage good action from our community members.
So, Chair, I just as Philip was talking, I'm on Facebook, and there's a great ad on there. Commissioner Treese has already given it a thumbs up on there as a like, and I did the same thing. But it's really good. So if you want to flip to Facebook and check out one of the ads, it's there this morning.
Great.
So it's good.
Terrific. Thank you.
Commissioner Willie, I think too, if, one extra step is to share it in addition to the like would be fabulous.
Okay, good. We'll do that. Any other commissioner questions or comments at this point? Okay, anything else, Marnie and Philip?
Nope.
Thank you.
Well,
as
thank you
always.
very much. I know you've gotten me to really understand that we are at a very serious juncture and that we all need to take action now to get this community spread get the community spread down. So thank you very much. Please extend our thanks to everyone on your team. I know, Marnie, the crew that has been working since, preparing back in January and February, and they've just been working flat out. So I do hope that you'll put together some plans to rotate people out so that they get a good rest, or at least a change of scenery.
Thank you.
Thank you for the good information. All right, we'll move on to the next item on our agenda. That's it for presentations. We'll move on to action now, and we have a couple of action items for today. And the first action is to authorize the chair to sign an employment agreement for a new county administrator. Do we have a staff report on this item?
Yes, Madam Chair, just briefly. As you well know, there was an extensive search to replace Bob Davis, who retired, and we hired a consultant, Ms. Catherine Tuck-Prerish, and we narrowed it down to a number of candidates, and then there was a series of interviews involving the board and community partners and the department heads. And then last Friday, the board directed me to go out and negotiate a contract with Ms. Tanya Anji. And so over the weekend, we worked back and forth and came together with an acceptable employment agreement. And that is what is before you today. Ms. Angie has signed the contract. And so with this action, it would authorize the chair to sign that contract. And then it proposes that our new CEO will start on August 24th. on mute, I believe.
Yes, thank you, commissioners, for participating in this national search with the Novak Consulting Group and Catherine Tuck Parrish. We received 60 different applicants for this position. You were very involved in reviewing various applicants. This COVID public health crisis really threw us a curveball in our timeline. But we all worked through that and had face-to-face interviews in addition to having virtual interviews. Thank you, commissioners, for participating in all of that. And I'm really pleased that we had good discussions through that whole process. And now we're at this final step. So commissioner questions and comments. I see Commissioner Willie, you're unmuted.
Yeah, I was just getting ready for the action, so I don't have any questions or comments.
Okay. Does anyone have any questions before I ask for a motion?
I have a comment after the motion's made.
Okay. Would someone like to make the motion to authorize the chair to sign this employment agreement for a new county administrator?
So
So
moved.
move. Yeah.
Second.
We have a motion from Commissioner Willie, a second from Commissioner Scouten. Any comments?
Yes, I have a comment. This action is really two actions. One is a hiring provision, and one is a contract. And I've made no secret to several of you, in fact, all of you, during the negotiations that there are several terms that I don't particularly like, but I'm voting in favor, not as a motion against the applicant. It's simply in any negotiations, there are terms that people like and they don't like. So I'll support the motion, but I still don't like some of the terms.
Any other commissioner comments before we vote? Commissioner
I-
Treese.
Go ahead, Commissioner Scouten.
Oh, thank you. I have no reservations about the contract. I'm really looking forward to our new hire. She's an incredible candidate. I think she's extremely qualified. I feel very fortunate that we'll be able to go forward with Ms. Tanya Ainge. But I also want to note my gratefulness for the great service of our current interim CAO. What an interim that he has served under. And I can't say enough great things about him. It's been a great bridge between Bob Davis and our permanent position. And I'm very excited. Today's a great day for Washington County.
I would like to chime in here. I think that it was an exhaustive process. You talked about the numbers of people that had that applied. I think that we had a recruiting firm that worked well with us, and that was a key element to our success here. I also, as we went through the process, I want to compliment our finalists. I think that our finalists we had excellent choices, and we made a hard choice, and I'm pleased with where we are. I'm also excited, and I think it's a great day for Washington County. So with that, back to you, Chair.
Well, if there aren't any further comments, now is the time for us to vote. All those in favor of adopting this motion and adopting this new contract, please vote by saying aye.
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 Enthusiastically, aye.
Any opposed? The motion carries unanimously 5-0. Thank you very much, colleagues. Philip will be issuing a media release today. I'll make sure that you all have Tanya Angie's cell phone number so that you're encouraged to call her and say hello. And we very much look forward to her joining us on Monday, August 24th. We do have a interview process going on for our Chief Equity and Inclusion Officer before that time, I believe, and Steve Rhodes, our interim CAO, is asking her to please participate in all of that. So I'm hopeful that we'll be able to bring her into that process before she officially starts. We each have a role in helping Ms. Angie get introduced to everyone here in Washington County. And so in the coming weeks, we'll be talking more about how we may go about that and different groups that you want to make sure she's familiar with and connected with you on. And so we'll get that set up. So please be thinking about that. Once again, I sincerely appreciate how you have all actively participated in this process. This is one of the 3 people that we hire to run the Washington County Agency and then Clean Water Services. I think you've put together a really strong team. I very much enjoyed the learnings, the journey together with all of you. I continue to enjoy and appreciate having the opportunity to work with the 4 of you. So thank you again, my sincere appreciation. So next we'll move on to the second action item for today, and that is to amend the contract with our interim CAO. As mentioned just a moment ago, we've been so very fortunate to have Steve Rhodes working with us during this transition, on top of having him help us during a public health crisis, unlike that of which any of us have seen in our lifetime. He's been tremendous. As we worked to extend his contract previously, since the timing of all of this extended, we did make provisions to cover additional costs. Through his great negotiation skills, he was able to avoid those costs. And so here we are with a third amendment to the contract to essentially remove those provisions. So our thanks go to Mr. Rhodes for all of that. So do we have a staff report on this contract, Mr. Rapplier?
Madam Chair, you just gave it, so. That was exactly what I was going to say, so.
Oh, well, I'm sorry if
No,
I
that's
in
good.
any way stepped over the line there or exceeded my authority and responsibilities. So thank you for your graciousness. Are there any commissioner questions or comments?
Madam Chair, I'd simply move for the motion, but I would also like to thank Steve for bringing back this savings to the county. We had an agreement. We could have simply stuck with it, but he, in his honesty, said, well, I've reduced some costs, so I'd like to share those with the public. So thanks, Steve. That was great. But I'd move for the item.
Is there a second?
Second.
We have a motion and a second to amend the contract for our interim county administrative officer. Any last questions before we vote or comments?
Thank
Okay.
you, Steve.
All those in favor, please vote by saying aye.
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 Any opposed? The motion carries unanimously 5-0. Thank you very much, Mr. Rhodes, and we're very much looking forward to our continuing work together in the coming weeks. May they go quickly for you so that you can get back to other things in life, but may they not go too quickly at the same time. Okay, so the next item on the agenda is oral communication. Mr. Moss, do we have anyone signed up or present in the auditorium?
Yes, Chair Harrington, we have Mr. Dale Feek participating on Zoom, so I will allow him to talk for you.
Thank you. Mr. Feek.
Chair, Madam Catherine Harrington, can you hear me?
Yes,
Can
we
you hear me?
can. Yes, we can.
Thank you. I'm Dale Feek, Chair of Washington County Citizen Action Network. Well, as I said, Madam Chair Harrington, Commissioner Willie, my District 4 representative and commissioners. This morning, I listened to Joe Scarborough on Morning Joe. He said that we're in the midst of a deadly pandemic that is going to be with us for a long time. He said, wear a mask, socially distance, and be responsible, as Marnie explained to you earlier. Then Joe Scarborough introduced Mike Barnicle, who said, if you take everything that has happened in the Trump administration so far, especially in the last 6 months, and neatly summed up in one phrase, it is dereliction of duty. I'll repeat, dereliction of duty. Mr. Barnicle went on to say, when Donald Trump stood on the podium in front of the Capitol on January 20th, 2017, President Trump took an oath, and the oath was to protect and defend the Constitution of the United States. He has done neither. He hasn't protected us. He hasn't defended us. Mr. Barnicle then went on to make 3 points. 1, as we sit here today, several states are on fire with a virus. California, Texas, Georgia, and Arizona are on fire. Anthony Fauci told the Senate yesterday that he is concerned with a daily infection rate that could pop up to about 100,000 a day. We have the state of the economy, and the second point was, we have the state of the economy with over 40 million people collecting unemployment benefits. Third point, now we have the news that the President of the United States, his White House staff, the Secretary of Defense, and the National Security Council had an inkling, had a knowledge of the fact that the Russians were paying bounties to kill American soldiers and Marines in Afghanistan. In summary, Mr. Barnicle said that we have a president who can neither protect us or defend us. It's a dereliction of duty. I agree. Now, when I signed up to speak, I said my topic would be the Environmental Quality Commission. And I was wrong. I misunderstood, I guess, with the top that was going to be on your agenda today. So, but I am now quoting Mr. Barnicle. I have read the book titled On Tyranny, 20 Lessons from the 20th Century by Timothy Snyder. Lesson number 2 is defend institutions. That is, institutions that help us to preserve decency. I am a strong supporter of newspapers, free press, and our Oregon Department of Environmental Quality, which I thought I was going to be talking about today, led by our director, Richard Whitman. Since 2013, I have made public comment before the Environmental Quality Commission, who oversees the DEQ, just like you oversee all your responsibilities based upon the staff that makes recommendations to you. Mr. Whitman and his staff make policy recommendations before the Environmental Quality that protect and preserve Oregon's air, water, and soil to counter the recommendations that Donald Trump's EPA appointees have reduced rules and regulations that were adopted to preserve and to protect air, water, and soil. Lesson number 10 from the book On Tyranny is believe in truth. To abandon facts is to abandon freedom. If nothing is true, then all is spectacle. Lesson 19, be a patriot. Now, I really like the statement on the thing that Marnie showed, show your patriotism safely. I love that sign. Set a good example of what American means for the generations to come. They will need it. The point is not that Russia and America must be enemies. The point is that patriotism involves serving your own country. The president is a nationalist, which is not the same as a patriot. A nationalist encourages us to be our worst and then tells us that we are our best. And it goes on to what it is. But a patriot has universal values, standards by which he judges his nation, always wishing it well and wishing that it would be better. Lesson 20, be as courageous as you can. If none of us is prepared to die for freedom, then all of us will die under tyranny. I respect you as county commissioners for standing up what's right and having good ideals and try to protect us. We have a national crisis. Thank you for working on that issue. I am a patriot. Thank you.
Thank you, Mr. Feek. Mr. Ross, do we have anyone else signed up to address us today?
We do not, Madam Chair.
All right. Well, Next on our agenda then are board announcements. And I have failed to put the packet up right in front of me. So bear with me for a second. All righty, so as usual, I will announce that there is a Board of Commissioner work session next Tuesday, July 7th, starting at 8:30, and a board meeting at 10 a.m. I know that I will only be participating in the Zoom meeting of the board meeting myself, as I will continue to be on vacation next week. Then the following Tuesday, July 14th, back on July 7th, Commissioner Dick Scouten will also be Zooming into that meeting. So as to ensure that there is continuity with what's happening in the auditorium, I've asked Commissioner Roy Rogers, our former vice chair, if he wouldn't mind running that board meeting. And your still thumbs up on that, Commissioner Rogers. Thank you very much. I appreciate that. And then on Tuesday, July 14th, we'll have an extended work session. There is no board business meeting that day. And then we'll pick back up with Tuesday, July 21st, work session at 8:30, board meeting at 10. And then our last Tuesday of the month, July 28th, we'll have a work session in the afternoon and an evening board meeting starting at 6:30 p.m. Are there any other board announcements? I do want to thank Commissioner Treese for handling that governor's meeting yesterday and making sure that we all had the benefit of the slides that the governor shared with everyone. Are there any other board announcements that you're wishing to share, Commissioner Scouten?
Yeah, I have a couple. One is just noting that today is the first day of our new fiscal year for 2021, July 1st. Number two, I had set out some vacation plans. They do still include next week, but later in the month is now up in the air. We had some plans to go up to Canada. That's probably not going to happen. We're not sure what our vacation plans, if any. Things have gotten so bad with COVID, it's going to be hard to, we may have to make some fairly significant vacation changes. And then finally, just to let the board know, I will be sitting and listening in on the governor's staff conference with Leah Horner later this afternoon. That's it.
Thank you. And I can't remember for that AOC Washington County representative for those meetings. Commissioner Scouten, are you the person that stepped forward to handle those meetings? Yes.
Yes,
you were.
and that's
Okay.
the one that's going up today at 1 o'clock with the
Great.
governor's staff person.
Great. Are they set up for every week, same day, same time sort of thing?
That's my understanding.
Well, great. Good. Good. And I'll continue to try and participate in the weekly calls that AOC has coordinated with the state. Those have been on Fridays. You're all welcome to dial into that and continue to. There is no such meeting this Friday. So we'll just make sure we're all covered and bringing information in and sharing it and whatnot. Commissioner Rogers.
The only thing I want to say in closing is that we thank Steve a lot, and we should. He's done an outstanding job. But Alan, you've done a really nice job negotiating on a contract as well. It's never that easy to go through and to do those things. And even though I expressed, that I had some differences on a few items, I respect what you did. I think you did an outstanding job. So thank you.
Thank you for mentioning that, Commissioner Rogers. In fact, he and his whole team have been really cranking out a lot of different contracts. When we think about the coronavirus relief fund, they've been setting up the mechanisms along with finance to make sure that we've got good contracts that protect both parties. and follow up on all the requirements. So thank you so much for highlighting that.
I'd like to
Commissioner
chime in there and say, I agree, thank you. And Alan worked over the weekend on this contract. There was a lot of communication that went back and forth. And I know that he worked into late evenings before the weekend as well. So it's really appreciated, and it got us onto a timeline that is really beneficial for us. So my special thanks to Alan as well.
Great, great. Well, given that we are here, as Commissioner Scout mentioned, in a new fiscal year, we do have a long weekend, holiday weekend coming up. I just want to do one last check-in with our leadership team to see if for Clean Water Services with Diane Taniguchi-Dennis, or with legal and CAO with Alan and Steve. So Diane, you want to kick us off?
Yes, thank you. Clean Water Services, we had 3 potential exposures to COVID, and I want to say they all came back negative. So the team is remaining healthy, and they're responding well, but we're looking forward to the holiday weekend. We're still on 24/7 with the plant. So far, so good. I would like to schedule an executive session in July. So I'll work with the county folks to do that. There's something I need to talk about as it relates to the Austera contracts. Thank you.
Have you and Diane, have you and your team been able to secure the appropriate PPE, such as face shields? And then I'm seeing through the national media in hospitals more and more of those respirator helmet kind of things, face guards.
Yes. Yes, so the primary focus is to make sure that the healthcare system has what they need. Clean Water Services, we're actually looking at alternative ways to get some face shields in. There's ways we can make them that that doesn't get into the healthcare sort of issue. And I've got lots of ideas of making cost-effective masks and PPE. So I'll have some proposals probably in 2 weeks for the board to consider. Not only can we do it for Clean Water Services, but we could help secure potentially a local supply for the businesses that they need in reopening. Supply is short, cost is high. So I'm trying to find cost-effective solutions for everyone.
I'm very mindful of the fact that the team members are in water areas with droplets, with sewerage when they're down there trying to unclog pipes and so forth. So want to try and make sure they can go home healthy to their families.
Thank you.
I'd just like to chime in that the need for PPE is great. We see that in the work that we're doing in our business recovery centers and in other places. So I'm really anxious to see what you have to offer, Diane, and the sooner the better.
Great. I'll keep working on it. So we'll make some proposals. Yeah, it's great. Thank you.
Commissioner Rogers?
No, not at all. I would simply echo that. We've been going back and forth, and I know the chambers in my neck of the woods, as well as businesses, are anxious to not have to stockpile. And if we could produce a constant stream of masks and shields are much better than masks if we can figure out how to do that. That would be just a wonderful benefit to the business community. So I'm hoping that as we talk to the business loan group, that we put some money aside there, as we know, and hopefully they'll see that as a favorable investment in that technology.
Thank you.
Commissioner Willie, did you have a question or comment?
Just a comment. Yeah, Roy, our group that Pam and I are involved with, we've been talking about PPE as well. And just to emphasize what Diane said about the cost, my neighbor here in Hillsborough, he owns several restaurants and businesses in Seaside, so obviously a different county. He was telling me yesterday that he is buying masks for all of his employees in the restaurants and all the businesses, and he's paying $10 to $12 per mask.
Wow.
And when I asked Jack last week a cost, he said between $2 and $2.50. So that's the kind of that's the kind of price gouging that our businesses are experiencing. I think emphasize the point of why, if we can go out into the marketplace and get some significantly reduced prices and help them out, that's what we should be doing. It'd be basically a 4-to-1 return if our businesses are paying that kind of money for a mask.
Yeah, I'm trying to navigate getting the price point down to 50 cents or less. I have some solutions that could potentially get it to 30 cents or less, but it would take investing in actually the mask making equipment. So I've gotten quotes of what it would take and the lead times for making essentially 1 million masks a week. So at that point, you can get the price point way down. But it's whether or not we want to take on that endeavor with some partners. So yeah, but it's needed. And you can
Yeah,
see
absolutely.
the supply chain is so constrained and the pricing is so high. Yeah.
Okay. How about from Alan and Steve?
This is Alan. Thank you very much for the kind words. I'm very glad to be able to help to get this excellent employee on our staff in this important position. And my staff have been working really hard with, it's been a team effort with the CAO to get those contracts out the door and get that CARES Act funding. The other thing I just want to note is, so next Tuesday, we're going to have the first introduction of the charter amendments. And then in 20 days later, we're going to have a public hearing on those proposed charter amendments. And I've been working with Commissioner Treese and Alex Vidal on getting that next round out. That will also include some ballot title and explanatory statement language for you to review. So, thank you.
Great. Thank you. How about you, Steve?
Just want to let the board know about the listening circles that we've been working on. I've talked to the board previously. We've now pinned down the date for the board to be in the listening circle, and I'll get material out to you, but I just wanted to call it out to you. It's on July 13th, which is, I believe that's a Monday, and it'll be from 10 a.m. to noon. And I will get information out to you on it and let you know that you can connect with Kathy and she can get you linked up for that listening circle.
Great. Great. Well, thank you, commissioners, for continuing to be flexible and nimble so that we could have today's special meeting. I wish you all a happy July 4th Independence weekend holiday, which we'll be officially observing with the agency closure on Friday, July 3rd. So I believe that's it for today. Is there a motion to adjourn today's meeting?
Move to adjourn.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously 5-0. Special meeting of July 1st, 2020 is hereby closed. Thanks, everyone. Take good care.
Bye-bye.
Bye-bye.
Yeah. Okay.
I'll catch you later, Kevin. I gotta go.
Okay.
Okay, so this is, yeah, hers, okay.
Yeah, and I'll scan it and I'll add Catherine's to it.
Okay, I'm still expecting to get originals too.
Okay, and then we'll have her. send
Yeah,
those.
do it again.